Well, it is National Family Caregivers Month. Nearly a quarter of adults in California provide unpaid care each day, handling everything from grocery shopping to complex medical tasks. And they often pay out of pocket to meet loved ones' needs at the cost of their own financial security. Joining me now to give a better picture of the issue caregivers face and the crucial support they need is Michael Murray with AARP. Good morning to you.
Good morning. Thank you for having me.
You know, this is something that has affected members of my own family, friends as well. It is a real issue as you get to kind of a portion of your life, right?
It absolutely is. You know, at some point we're all going to be caregivers or will need some level of caregiving. You know, the population's aging, and whether people acknowledge themselves as a caregiver, they probably are doing things that they are, in fact, helping people and are a caregiver.
So AARP just released new caregiving data. What stands out most about these numbers?
You know, I think what's really striking is since 2020 at a national level, caregiving has grown exponentially to 63 million caregivers. So here in California, it's over 7 million people. And as you said, that's about 1 in 5 people. 23% of folks. I think what really stands out is the number of people who are having to make adjustments in their lives, what it means for them to providing, many times, unpaid caregiving, which is about $4.4 billion worth of unpaid care in California.
So how many exactly like caregivers do we know? Some of those numbers are there in our state, and what types of care are they ultimately providing here for the most part?
We have just about over 7 million here in California, caregivers. And the types of care range from basic needs, bathing, feeding, making appointments, helping them manage their medications, arranging for transportation, taking them to the doctor, whatever is needed for their loved one or their friends.
You know, it can be awfully expensive too. I mean, caregivers, there's many are still working. They're kind of balancing taking care of mom or dad or whoever it may be while paying out of pocket, balancing their own finances. What do you find the impact is on this?
It's fairly significant, actually. We know that on average, caregivers pay about $7,200 a year out of pocket. And while there are things in place to try to offset some of this cost, this creates quite a financial burden for those who are caregiving, for caring for those they love and their friends. Those caregivers are having to make tough decisions too, between their own personal expenses, things that they need to take care of their own family, including rent, paying bills, groceries, and their own medication.
And I know you guys you're in their corner definitely. So what kind of changes or policies are you all working on to kind of make life easier for families of caregivers?
Well, here in California, we are very proud that our state team was a champion for Senate Bill 590, and that expanded California's paid family leave program to include a chosen family, so not your traditional family, and a reflection of who we are in California. And soon, what that will mean is workers will be able to take time off, paid time off, to care for their loved ones or their friends. At a national level, we continue to fight for a Credit for Caring Act. It's a federal tax credit up to $5,000 to help offset some of those taxes. And we also are trying to support lowering costs for caregivers, which would help expand flexible and health savings accounts they have through work.
All right, well, keep up the good fight. Thank you, Michael Murray with AARP. We appreciate your time today.
Thank you so much. Have a good day.
Of course, you too.
Now, in our 7 o'clock hour, we had a chance to talk with a Kaiser Permanente neuropsychiatrist about caregiver burnout. Here's some of what he had to say.
Being a caregiver is probably one of the most important and at the same time most demanding roles that somebody could embark on. And caregivers have a tendency to sacrifice their own self-care, their own needs, in an effort to take the best care possible for their loved ones. And it's this accumulation of stress, you know, that leads to what we define as caregiver burnout, which is a state of physical, emotional, and mental exhaustion.
Some practical self-care strategies include setting boundaries and learning to say no, not being afraid to ask for help, taking care of yourself, eating, exercising, and getting rest, and considering joining a support group.